This is Travis Rodgers. I'm here with Dr. Chi of Glidewell. Thanks for joining us, Dr. Chi.
Absolutely. Thank you for having me.
So, a lot of buzz in the industry about some of your chairside milling and your digital workflows that you're doing. You have a lot of friends. You're a dentist yourself. What are the things that you're doing? What are the things that you're hearing in the industry about adopting chairside milling and adopting the digital workflows?
Sure. Digital is such a big thing in dentistry now. It makes things faster, more efficient, more comfortable for the patient. But it is disruptive. I think a lot of dentists with change, or most people in general, but certainly in the dental practice, when there's a big change in the workflow for restorative dentistry, it can be a little scary. So the fear of seemingly removing the lab from that equation, the support, and now transitioning to doing it all on their own in the office can be a very scary proposition. So I think that if they didn't learn it in school, they don't really see it as that immediate need to kind of shift away from that process. But what we're seeing is we can make restorations with the same quality, the same strength and materials that are available through the lab right with our chairside system. And so really it is a system without any compromises for the dental practice, better for the office, better for the patient.
Nice, nice. So what is Glidewell doing to get doctors past that concern, to help them get past that concern?
Sure. Instead of removing the lab from the equation, it's really bringing Glidewell and the laboratory right into the practice. So it takes the best of Glidewell's engineering, software, and materials to the practice, and we have we have support. So they're always dialed into Glidewell's technicians. So if there's at any point questions or a need to help with margins or design or scanning, any part of the process at all, they can call us and we can dial into their system, see exactly what they're working on, help them through any challenges that they have so that they can deliver a restoration for their patient. So they're never alone, they're never without anyone backing them and supporting them through the process.
Nice, nice. Well, you've implemented it in your practice. You know a lot of people. You guys have helped a lot of people implement it. If you're kind of looking at the top tips that you would suggest, your suggestions to help them implement CAD/CAM, what would they be?
Sure. I think, again, that disruption to the practice and the scheduling, most practices work like a finely tuned machine. And whenever this system comes into the equation, it's best to take things slowly. You don't have to feel pressured into doing same-day dentistry right off the bat. Some do successfully, but the beauty of this is dentistry at your own pace. So the practice can deliver restoration still in those same 2 appointments if they are comfortable doing that. Learn the system, learn the workflow, get through that learning curve. With all technology, there is a slight learning curve. But once they get comfortable with that process and how long it's taking them to deliver restorations or to make it with the system, they can then begin modifying their schedule to maybe next day dentistry and eventually same day if they want. But they don't have to. Practices have implemented this successfully and still doing 2 appointments. So that's the beauty of this. You can deliver it at your own pace. And if the time calls for it for same day, they certainly can. There's really no arguing against doing it same day. If you ask any patient, they would certainly prefer, again, if there's no compromise, which there isn't, to get a restoration in that same appointment. Most certainly would. I can't imagine anyone denying that. And also getting the team on board. So the dentists, they do restorative work every day. They're not on their own. The team is a huge component to the success of a dental practice and the success of the dentist delivering quality treatment. And it's no different when adopting this technology, getting the team on board, supporting and working together to move forward through the adoption of this newer technology. It's to make the practice better, to make things more efficient, and certainly at the end of the day, delivering quality cases, quality treatment for patients in the fastest time possible.
Well, there's a lot of buzz at the show here about fast mill I/O. Can you tell us a little bit about fast mill I/O?
Sure. The fast mill is the key component of the whole system. It's the CAM portion, computer-aided manufacturing. So it's a system with a small footprint that's fully electric. So it's a high torque system that's the only one that's capable of milling fully sintered zirconia. So we have a monolithic Bruxer now material. Now stands for no oven weight. And what that means is there's no need for post-mill processing. So once it's out of the mill, you can take it straight to the patient. So you just finish off the little sprue connection. It's strong enough, it looks beautiful, and you can deliver it for your patient right then and there without the need to go through a phase change in the oven or even stain and glaze. So it's actually ready to go right out of the mill.
Well, it looks like it's really easy to use. I would love to take a look at it. Can you give us a quick demo?
Absolutely. Let's take a look at it.
Take a look. Glidewell is known as one of the top innovators in the dental industry, and one of the things that you guys also specialize in is simplifying processes. Tell us about how you simplify the design process using this product.
Absolutely. Simple is the way to go, and everything was developed in-house and modeled after what the lab currently does in our regular production workflow for lab cases. So it starts with the software, fastdesign.io. The software is, again, a version of what's used in the laboratory, and with any case, once it's scanned in and then sent to the software, the first step is to mark the margin. You're going to define the start point of the restoration, and from that point, the software, we have a team of over 60 software engineers that made this to be as simple as possible. So it analyzes the adjacent teeth, and it also kind of goes into the history of a lot of the cases that were made at Glidewell to generate a proposal that works for the situation. So then you'll have a restoration that will generate fill the space, mesial and distal contacts, and also taking into account the opposing dentition, so that you get a restoration that is both aesthetic and functional. At this point, the clinician just needs to evaluate the design and then dial in the contacts, the proximal and occlusal contacts, to their desired levels. Through training, we have recommended values, but the beauty of this is each dentist can dial this in to that number that works great for them with minimal adjustments after it's milled. And I'll just show you here, once you have a number that works for you, let's say it's 20, I can set these on 20 for the proximal contacts. With a click of a button, the software automatically will modify those mesial and distal surfaces to get those contacts. So when it's milled, again, there should be very little adjustments for the dentist. It should be very straightforward for them, and you can evaluate it with the opposing, evaluate the occlusion. So with that generated proposal, a lot of times there may not be a need to make any changes, but the dentist still has freedom to modify the design as they would like. So we have a few tools here on the left where aesthetics can be very subjective. So if a dentist wants to maybe broaden the contact, it's very easy. This tool is called Freeform. You can broaden a contact and make a change like that. Or if the dentist wants to modify a non-functional area, if they want to change the cusp shape or height, they can very easily do that if they want to. But again, it's not necessary for any or for each case. It's available if they want to, but we find most users, if they are happy with the proposal, they dial in the contact values and then just send it right over to the mill. And that's the fast mill here. So it seamlessly will transfer that design to the system. And again, most cases are milled with that monolithic Bruxer Now material. And I have a couple block examples here. This is what the block looks like, and you can see these are manufactured within Glidewell, and we have a lot of data on the size of most posterior teeth. And you can see this is kind of a unique shape of a block compared to any other block that's available in the market, because it's to cut down. It's something that will accommodate most posterior crowns, but also it's sized in this size like this so it can reduce the amount of milling time required. So that's the pre-milled version, and this is what it would look like with that final restoration cut down. You can see it cuts very, very precisely the anatomy and the intaglio aspect, and the margins are super crisp, super thin if needed, but the material is very resilient, and the system is capable of doing that. Any dentist that has removed a zirconia crown knows how challenging it is to modify and cut through it, but this system is incredibly powerful to be able to mill this down to a perfect fitting restoration. It's very amazing.
Well, Dr. Sheets, thank you very much for your time. It's a beautiful system. How's our audience get in touch with you?
They can get more information through glidewelldental.com or glidewell.io. It's a website dedicated to the system. You can learn more about the materials and the technology behind it.
Perfect. Thanks for joining us.
Absolutely.
Appreciate it.